Which of the following rhythm disturbances is considered pathognomonic for digoxin toxicity? Atrial flutter with PVCs. B. Sinus bradycardia with PVCs. C. Bidirectional ventricular tachycardia. D. Mobitz type 2 second-degree AV block. E. Accelerated junctional rhythm. Pause the video for a moment and the answer is bidirectional ventricular tachycardia. Digoxin toxicity may result in nearly any rhythm disturbance. PVCs are the most common and typically represent the earliest rhythm disturbance. However, the two rhythms that are considered pathognomonic for digoxin toxicity are bidirectional tachycardia and PAT with AV block. Clinically, these rhythms are extremely malignant and frequently precede the onset of non-perfusion rhythms. Thus, many patients are treated before these arrhythmias develop and they are not commonly observed. A 62-year-old male is being transported to the hospital by EMS with a chief complaint of chest pain and shortness of breath. After placing the patient on oxygen and giving aspirin and sublingual nitroglycerin, the EMS providers transmit the initial 12-lead EKG, which is shown below. Which of the following is the most appropriate next step upon EMS arrival? Prepare the catheterization laboratories STEMI team for immediate cardiac catheterization. B. Start a nitroglycerin drip to be titrated until the patient is pain-free and give a loading dose of low molecular weight heparin. C. Start a nitroglycerin drip and give a loading dose of clopidogrel and a loading dose of low molecular weight heparin. D. Start a nitroglycerin drip and give 25 milligrams of oral metoprolol and a loading dose of low molecular weight heparin. E. Place nitroglycerin paste on the patient's chest and give a loading dose of clopidogrel, oral metoprolol, and a loading dose of low molecular weight heparin. Pause the video for a moment. The answer is Answer is A. Prepare the catheterization laboratories STEMI team for immediate cardiac catheterization. The patient's EKG demonstrates ST elevation in lead AVR with profound, diffuse ST depressions in the remaining leads. While lead AVR is routinely ignored in clinical practice, it provides useful information. In patients with chest pain, ST elevation in lead AVR, in concert with diffuse ST depressions, is a highly specific indicator of left main disease. While all of the interventions noted in the other answers may be appropriate, none of them favors immediate PCI by cardiac catheterization, which is the standard of care among patients with STEMI.